over here Dr. Sunil Khetarpal, sir, who is the director of HPIE New Delhi. Right, so next, the esteemed panelist, I would like to call Dr. Navneet Bali, sir. Please come up on the stage. Dr. Navneet Bali, sir. He is the CEO of Narayana Health, President, HPIE Delhi chapter. Please give a big hand for him. Now next, I would like to call Dr. Shuchin, Bajaj, sir. Please come up on the stage. He is the founder promoter of Ujala Cygnus Group of Hospitals Advisor, HPIE Delhi. Now, the next I would like to call Dr. Sajal Singh. Dr. Sajal Singh, sir, please come on the stage. He is the Chief Operating Officer of Assam Cancer Care Foundation, Guwahati. Can we have a big round of applause for him? Now, next I would like to call Dr. Narin, Sehga, sir. Please come on the stage. He is the Medical Director, Sehga, NEO New Hospital Secretary, HPIE Delhi. So can we have a big round of applause for him as well? So now the stage is yours. I would like to call Dr. Sunil Khetarpal, sir. You can now. Dr. Kamal Parwal, sir.
Dr. Kamal Parwal, Dr. Sanjeev could not come. Dr. Kamal Parwal, he is the Chief Medical Advisor, Akash Hospital.
Come on, everyone. Can we have a big round of applause for him? Okay, sir. Now you can take the session ahead. Thank you so very much.
A very good afternoon to all the esteemed panelists and to the audience. So we are here for a very, very important session. The topic of the session is, should private healthcare outreach like Ayushman Bharat, Prime Minister Jan Yojana incentivize or fund the infrastructural upgradation of private hospitals? I will just just walk you through some background about Ayushman Bharat. We all know that Ayushman Bharat has been into existence for last 4 years now. 23rd September 2018, it was launched in Jharkhand, Ranchi. That was the first city where Prime Minister himself launched. The inaugural PM-JAY was launched there. And I'm not going into the details of PM-JAY, the coverage part, the 50 lakhs coverage. We all know 50 crore, but now it is 65 crore, and it is for preventive, promotive, and curative, secondary and tertiary. The role of healthcare leaders has been very dynamic and critical in the last 3 years, especially I'm talking of last 3 years, because they have preserved through the COVID-19 pandemic and etched out a post-pandemic world, conceiving a progressive future. Now, working collectively on resilience part, the various healthcare domain leaders are collaborating for the breakthrough innovations, and by pursuing a cohesive, sustainable approach with the help of new generation technologies, healthcare delivery is witnessing rapid innovation and improved outcome. And embracing such innovative technologies, the digital-first approach can enhance patient centricity and is the need of an hour. It is the need of an hour. So Ayushman Bharat is a flagship scheme of the Government of India, as I mentioned, launched as recommended by the National Health Policy 2017 to achieve the vision of UHC, Universal Health Coverage. This initiative has been designed to meet the Sustainable Development Goals and its underlining commitment, which is to leave no one behind. That was the main one, that leave no one behind. And to address the healthcare system covering prevention, promotion, and ambulatory care at the secondary and tertiary level. Now it has got two components. One is health and wellness center, about 1.5 lakh, sub centers and primary health centers to be converted to wellness centers. And second one, the most important one, which we are going to discuss today here, is Pradhan Mantri Jan Arogya Yojana, that is Ayushman Bharat. Now this Ayushman Bharat PM-JAY was launched. The objective for launching this scheme was to ensure the comprehensive coverage for the catastrophic illnesses, reduce catastrophic out-of-pocket expense, improve access to the hospitalization care, and reduce the unmet needs, and to converge various health insurance schemes around the states, because every state was having its own insurance scheme. So, by Ayushman Bharat has also given an option to converge all the state-specific insurance schemes. So, with this, I think now we are here to discuss on the topic: should private healthcare outreach, Ayushman Bharat PM-JAY, incentivize or fund the infrastructural upgradation of the private hospitals? So I'll now start with the panelists. My first question would be to Dr. Shuchin Bajaj. Dr. Shuchin Bajaj, India is in the low human development category. We say that, and has 8.6 doctors per 1,000 beds and just 5 beds for 10,000 citizens. And the just released Human Development Report 2020 showed that out of 167 countries, India would rank 155th on the bed availability. It is way low down. And what are the initiatives and measures taken by the government to improve the bed and manpower ratio so as to achieve universal health coverage?
Thank you very much, sir. So, looking at all this data, that we have the least number of beds, I think, as you pointed out, 155th rank. We have one of the lowest number of doctors, the lowest number of nurses. We would all expect that all the hospitals would be overflowing with patients, right? We would be refusing patients all across. What is the reason that the best of the best hospitals in the country are running at 60% occupancy? You have large marketing teams in hospitals trying to go out and take patients. So what is this dichotomy is something that we need to understand. Of course, we need more beds. And it's not just the availability of beds, it's the distribution of beds and doctors as well. Almost 80% of these doctors that you have talked about are catering to less than 10% of our population. The rest 90% is being served by only 20% of the doctors. So we have to increase distribution, but we have to address the two most important A's in the 5 A's of healthcare that we keep speaking about, the awareness and the affordability. We have to understand that India is not just underserved in terms of healthcare, it is under-accessed as well. Our hospitalization rates are one of the lowest in the world. Our surgical rates are some of the lowest in the world. WHO says that an LMIC country like ours should have about 5,000 surgeries per 100,000 population per year. And this number can go as high as about 23,000 in countries where out-of-pocket expense is negligible and awareness is high, like the Nordic countries, the Northern European countries. But if you look at our numbers, we had only 2 crore surgeries last year in India, all over India. So that number is only what, 1,500? Where are the other 3,500 people? Why are they not getting operated? India has the largest number of preventable blinds in the world because it is assumed कि ये तो बूढ़ा है अंधा ही होगा, बूढ़ा है बेड पे ही रहेगा, ये नहीं चल सकता है, assume कर लिया हमने. They don't even know कि 5 मिनट की surgery से he can get well, right? That is why all the Guinness Book of World Records are found in India only. We are very happy doctor saying we removed this 20 kilo tumor from this woman, and photographs everywhere. That 20 kilo tumor should have been removed 5 years ago, Baba. Uska surgery क्यों नहीं किया 5 साल से? Because she didn't know the poor girl is carrying the tumor in her body and going around. And then you have doctors saying we don't have enough work. So awareness, and even if they're aware, they can't afford it. There is no affordability. So I think PM-JAY is doing some good work on at least managing affordability factor. But as long as we don't have awareness, as long as we don't have acceptance to treatments, as long as we don't have accountability in operations of all our hospitals, these questions will keep coming around and around. We can speak a lot about how the fee-for-service model is rotten to the core at the basic level. But of course, that is for a separate conversation. But I think we need to do a lot. The government can only play a certain part, but it's up to us, the AHPIs of the world, the IMS of the world, to increase awareness about what all options you have. The best example I can talk about is, and we've been discussing it, is how the mutual fund industry got together and raised awareness so much. कि mutual fund सही है. Everybody is now investing in mutual funds. India has the highest retail investment going on. You see our Sensex, the whole world is crashing, our Sensex going up because there's so much retail money available. Everybody is putting money into mutual funds. So can't AHPI or IMA raise awareness about all this, that you need treatment for this. Stop making excuses. You have affordable treatment available, you have accessible treatment available, you have hospitals where you can go to. These hospitals have actually beds lying vacant. So it is our responsibility to raise that, I think, rather than just looking to the government to do everything. Government will of course do, needs to do a lot more, needs to incentivize us to go into small towns and work. But we work a lot in small towns. Even in small towns, our occupancies are not 100%, even though there is no other hospital available for miles. But still, we are looking at 60%, 70% occupancy. So, what is the reason? I think we need to go much deeper into it to address the real reasons behind it.
Yeah, thank you, Dr. Sachin. I think very rightly mentioned the core issues in the healthcare in our country is affordability, accessibility, and availability of doctors. So these are the core issues, and I think a lot need to be done, and private players have to pitch in, and they play a major role, and their contribution would definitely go a long way. So with this, I think the next question is for Dr. Narin Sehgal. Dr. Sehgal, this Ayushman Bharat was launched in September 2018, so it has been 4 years now, and it is, you can see that it is not all states have adopted it, and some of the states like West Bengal, I think, is not yet adopted. Delhi also, you don't see the adoption of this scheme in letter and spirit. So, what were the challenges faced by the states in adopting and implementing this scheme, and what support or the flexibility options were given to the state by the central government? Because each state, it was a very open-ended scheme for the states. A lot of flexibility was given to the states. You can include more people in the family, you can even coverage you can increase. So all those leverage were given to the state. So what were the challenges, first of all, which were faced by the states in implementation of this scheme?
First of all, let me accept that this is one of the biggest insurance schemes which has been floated by our Prime Minister with a very good intention. And I think it is a very good scheme. The only thing is, as it happens very many times, this time also, what seems to be happening is, because it's a big scheme and it needs to be implemented well, it is going to take time, and few hurdles are definitely being seen at different levels. That is what we are facing. For example, if Delhi has not taken up this scheme, I think the reason, or West Bengal took it and then refused, probably the reason is political.
Sorry, I'm interrupting. West Bengal took this scheme when it was launched in September 2018.
Yeah.
January 2019, after 3 months, they withdrew West Bengal. So definitely, there was some problem in implementation.
I think from being in Delhi, what I can see, because I know this Delhi scenario better than what is happening in these states. Most of the times the reason is political, and the other reasons which could be there is probably they already have some schemes running, and that state probably wants to prefer that scheme, and they don't want to come up to the other scheme. And also there is a division of money which is being put into this scheme by these states. Probably that is the hurdle for this.
Okay, thank you. And which is one question to Dr. Commander Navneet Bali, which is also related to this. There are a lot of challenges because Tier 2, Tier 3 cities, That's always, the healthcare has always been a challenge. And Commander Bali, you have a hospital in Katra region, and which is situated in, I think it's tier 3, or it's a very remote rural area, you can say, having 300 beds. And this hospital is majorly doing Ayushman Bharat work. So, can you elaborate on the model which you have adopted, and what were the challenges you have faced while implementing Ayushman Bharat scheme in Katra, Narayana Health, Katra? And what is the future or the way forward for you?
Yeah, thank you so much. And first of all, thank you for paying attention in the hall, because I think this is a very, very important discussion which concerns everyone in the hall today. So my request to you is, there are some very bright people sitting here who are going to tell you certain things which you are usually not discussing. So my request to you is to just pay attention and just listen to what we are going to say. Thank you so much. Narayana Health started this hospital in 2016. It was inaugurated by the Prime Minister. And this is in a small village close to Katra. Those of you who have gone to Vaishno Devi, it's a village called Kakrayal. It's not even tier 4, I think it's a rural place. And a 300-bedded hospital was set up. A 300-bedded hospital was set up. And then thereafter, when the Ayushman Bharat scheme came, and you know Jammu Kashmir has got a universal health coverage, every citizen, every resident of J&K has got an Ayushman Bharat card. So this hospital was, by force, had to get on board Ayushman Bharat. But how did this hospital become successful? That's very, very important for us to understand. This hospital was set up on a land given by the Shrine Board. The hospital was built by Shrine Board. The hospital was equipped by Shrine Board. And also, a viable gap funding was given to NH for 5 years to run the hospital. For 5 years, because we knew that the working capital is such, and NH being and similar other private institutions have to answer either to the shareholders or to the board. So no other hospital would venture where they don't see a profitability. So after 5 years of struggle and extreme hard work by the doctors there and the team there, today at the 7th year, this hospital stands on own legs, does an EBITDA of around 10%, and takes care of their own costs. But please look at what is important. It was completely funded by the Shrine Board. And today the hospital is being run successfully and doing an EBITDA of 10%. So is a 10% EBITDA successful? Let us say 7 years from now you need to replace the machinery, you need to go on doing whatever needs to do, technology, etc., etc. That the time will tell. But right now the hospital sits on a platform which is well established, and 80% of patients coming to this hospital are Ayushman Bharat. 80%. So what we did was, and by the way, the hospital is full today. It's a 200-bedded hospital. The occupancy remains 210, 205. We try to cater for as many patients, and patients from everywhere. It also caters for ECHS, CGHS. There are hardly any cash patients left. So when I was discussing with many other, health authorities of many other governments, and they wanted to set up such hospitals, and they said that we are going to give you free land. I told their chief secretaries, I told their health secretaries, it's not going to work. Just by giving land, please understand that no healthcare provider in the private sector is just going to set up a hospital there if you just give me land. I want you to give me land, I want you to construct the hospital, I want you to equip it, and on top of that, I want you to give me a viable gap funding for 5 years, or 6 years, or 7 years, or 4 years. And then I will run a hospital, and I will make it profitable after 7 years so that you don't have to spend money. And that hospital is going to be really, really successful. This Katra hospital is a quaternary care hospital with the best of care. It has got a linear accelerator which costs 20 crores. It's got, the best of the machinery, the best of the doctors. The salaries of the doctors are as good or better than Delhi. The nurses, the staff is paid very well. So there is motivation to be there. The standards of clinical care, the standards of what happens to the hospital are outstanding, better than 70% of hospitals in Delhi. And that happened because of this model. As of today at 5 o'clock, it's Chief Secretary of Haryana is in that hospital looking at that model. The GMDA head has traveled and seen that hospital, and I think it's a very, very viable model if you look at a public-private partnership, because we talk about this phrase again and again, but most of them fail because either the private healthcare or a private partner does not find any value going forward and they exit, or usually it does not even take off. So to answer your question, you asked me this, and it's a very, very an example right in front of us in which a hospital has been successful taking 80% of patients from Ayushman Bharat scheme, catering for a population in a village. It's not in a city, by the way. It's in a village. And but because X, Y, Z reasons that were given, and this is a replicable model, which I've been telling many of the state health authorities, that if you want to do so, please give it to a private healthcare provider, give it exactly the way it is. It's a model which is well established. It is running right now quite successfully, and I feel that if it can be successful in a village near Katra, I'm sure it can be successful in Gurgaon, it can be successful in other places of country very well. And that's what the model is, and we are running it quite successfully here. Yeah, thank you.
Absolutely. Thank you, Dr. Narin. Incentives you got for this?
No, I will just take a page from Dr. Shuchin, what he was talking about, that even in the best of places, the occupancy in private healthcare is around 60%. And those of you who understand finance, the return on capital invested in healthcare is absolutely pathetic. So that means that a lot of people who want to invest in healthcare don't want to do so because there is no return going forward. It's a very, very capital intensive thing, because you need to invest in machinery, you need to invest in manpower, you need to replace. So I think just by saying that land is available, it is not going to do anything, especially in tier 2, tier 3 cities. And also, I think I just heard Dr. Narin and Dr. Shuchin also maybe sometimes earlier also, that looking at manpower in these places is very, very difficult. A doctor does not want to go and serve in a tier 2, tier 3 city. There is difficulty in getting nurses. So I think the incentives have to be similar to what was done in Katra. So the hospital has to be, the land has to be given for free, the hospital has to build, equip, and a viable gap funding, because first 5 years you can understand till the time the hospital breaks even, it can be very, very difficult. And then next 5 years you're going to take to make money, or what you want to do. So I think this incentive scheme or the tenders which are floated from time to time have to be modified and understood. And if you don't do that, just for example, there was a LINAC linear accelerator, this one floated sometimes back, in Rajasthan, to put up a cancer machine in the Jaipur Gold Medical College. This is done about 3 months back. There has not been a single private healthcare or anyone who has opted for it, because the conditions in that tender itself are so stringent and so difficult that nobody wants to go for it.
Absolutely. Unfortunately, there are not many takers for this incentive scheme, but you are an exception. Narayana Health Katra Hospital, I think it should be a role model for other other hospitals to follow. Thank you. I think this is a commendable job which you are doing there in Katra. And secondly, most important part of the funding part of the scheme, my question is to Dr. Sajal Singh. The scheme is completely funded by the government, and costs are shared between the central and the state government for implementation of the scheme. And now existing sharing pattern is 60 by the center and 40 by the state. But there are some exceptions, like northeastern states, all the northeastern states, and the 3 Himalayan states, like your Jammu Kashmir and Uttarakhand, Himachal. The ratio is 90:10. That is 90%. Your contribution, state contribution is only 10%, and 90% by the center. So how do you? What are your comments? What are your opinion? How are you running this scheme with minimal contribution by the state, and it's mainly funded by the central government?
See, firstly, I'd like to say that something what Narayana Hridaya has got in my organization also. I head the Assam Cancer Care Foundation, and we are coming up with total of 17 cancer hospitals in Assam, all equipped with top-of-the-line machines, including true beam everywhere,
Wonderful.
MRIs everywhere, CT scan everywhere, in 17 districts. It's unheard of, and I think it is one of the examples of a progressive thinking where they have broken the myth that cancer can only be treated in big cities. And my experience of last 1 year of operating these patients in 7 districts of Assam, including districts like Karbi Anglong or district like Kokrajhar, which were at one time very, very disturbed. And I have excellent team of physicians, oncologists, everybody. And they have come, and I have proud to say I have a 45-member oncology team in ACCF today, providing services in 7 hospitals as of now. And as you said, my hospitals are also mostly because the equipment has come from Tata Trust, the land and building has been provided by the government of Assam. So something like what the Shrine Board did, we also got it for, that capital basically we can assume is as a sunk cost, which is or we can say a philanthropic cost which both the organizations have given. So the concept of ROI, though, should have been existing, but that is not there because that the government says we have given. Now you start operating. 3 things we have to understand, that even if it is Ayushman Bharat, it is government funding only. So when you get viability gap funding, you are getting on the top of that what the government is spending. Finally, this insurance is nothing but a taxpayer's money which is being drawn and given back to these healthcare centers. So in the government's files, they are not only looking at it as a insurance money, they look at it that we are only funding it through a different route. It is a fee-for-service route, that when instead of giving a ballpark figure, they are saying whenever your services are being used, we are paying for it. Similarly, in our kind of system, we have a huge philanthropic donor pool who come forward for those activities or those costs which we are not able to meet through Ayushman Bharat. I have a huge donor pool. This country has got great people, and they do provide right from either corporates, PSUs, crowdfunding. So I don't have dearth of money to. No patient can be said that he did not have financial resources, so he did not get treatment. We have a ways and means to ensure that the most downtrodden daily wager, street vendor, he also gets the same treatment as anybody who can afford to pay. As regards to the share part is concerned, that is actually a decision taken by the Ministry of Department of Economic Affairs, based on the economic activities and the GDPs and other resources available to the state. Earlier, there used to be a concept of you had a Bimaru state, then from Bimaru the word has come to EAG state, and now we call aspiration districts and aspirational state. And it's a matter of policy whether the central government wants to handhold a state with their healthcare paraphernalia and provide certain succor to them, particularly the hill district and northeast, and they deserve it because they have been backward for a long time. So whether it is the state funding or a central funding, at the end of the day, it is government funding which is coming back to them. I just want to make one point here related to this scheme of Ayushman Bharat. See, when the Ayushman Bharat was launched, the political sloganism was, now with this card anybody can get any kind of treatment. The financial barriers are broken. So everybody thought that they can walk into the best of the corporate hospitals, show this card and take it. Whereas the charges and the tariff was not conducive at all for a private player to take a large volume of such patients, which is true. I have also run hospitals, so I exactly know. But the point in question is, which the policy makers have to also think, that these are basically voucher for service. And these vouchers have to go back to the public health system, the district hospitals, the medical colleges. If their utilization of Ayushman Bharat, you will find negligible. A medical college of Guwahati, they only clock approximately 75 lakhs worth of Ayushman Bharat money per month with a 750 beds. Whereas in my kind of setup, I am almost doing 3 crores in some hospitals, almost 3 CRs from Ayushman Bharat. The point is, this money which is coming to me, I am infusing it for the development. I am a section head company, I am not for profit. So we are finally infusing it back into our system. In case what has happened, the problem is perception is that Ayushman Bharat means you have empowered the person to go and buy private healthcare. I think the mindset should also be that the Ayushman Bharat should be also promoted in these government facilities. They should get that money back, and the Hospital Management Society should put that money to improve their hospitals further instead of looking for an annual grant and a tender. Example is in Kenya, we had a voucher management scheme there run by PwC. I did that project for around 2 years, where we were supposed to monitor that how many vouchers you have served and what money did you get and what is the quality improvement or infrastructure you have done out of the money which you received out of this funding. So until and unless that thing happened, this instrument is actually not to empower the consumer only to purchase private healthcare. He should be empowered to access to quality healthcare, which at one time was very good. I am a medical doctor. I remember our colleges used to be the best. Our doctors used to be the best. Why they are not doing good? Because of resource crunch. Now this much money is available, but they are not using it. They are pumping everybody back to the private sector. So these two things have to understand. And yes, I would say in Ayushman Bharat scheme, things are very viable if you have the hospital for free. If you have the hospital for free, operationally it is not, it's a wonderful scheme. It empowers everybody. It's a fun to see. If you, I invite all of you to come to Assam and see how a centrally air-conditioned facility works in a district like Kokrajhar or Tarang, where there was no MRI for the last 75 years. We have given the first MRI to a district. Even those kind of histories we have created, and that is working. So government is also looking at pooling in fund like this and bringing it to the level. But instead of doing this, creating new, I think they should also look at using this fund back into the system so that the public health facilities also improve and benefit. That is how it will happen. Thank you.
Great model. I think we must compliment. Whatever revenue or surplus, I must say, not profit, because you are a not-for-profit organization, you said, the chain of hospitals. Whatever surplus you are generating, you are flowing it back for the upgradation of the infrastructure of the hospitals. I mean, so that is amazing model. I think your suggestions are also very well taken. That same way we can do it for the public. Next question is to Dr. Kamal K. Parwal. Dr. Kamal, we have this Ayushman Bharat scheme, and then we have the private health insurance schemes, GIPSA. So how do you compare these private and Ayushman Bharat scheme and the viability and sustainability of the hospitals implementing these schemes, and what are the challenges in implementation of these schemes for both, for even the private? I'm talking of the private insurance schemes.
Well, India is a large country of variable socio-economic educational standards. Therefore, one size doesn't fit all. That should be the dictum. And it is therefore only that so many schemes have come up in the past, are there most innovatively in many of the states. We had earlier big schemes in Andhra Pradesh running, then in Rajasthan and many other states, and then there's a national scheme like PM-JAY and all that. It is really amazing and news to me by listening to my co-panelist here this afternoon that Ayushman Bharat scheme is really working wonders in the aspirational districts across the Brahmaputra, great Brahmaputra region, great state of Assam, and the remote village of Jammu and Kashmir. But in both the cases, as I could understand, it is because the philanthropists are the takers and philanthropists are the promoters. Ma Vaishno Devi Shrine Board has invested immense amount of money. So the operational cost only, if it can be taken out with good efficiency, then these schemes can really make wonders. But in I come from Delhi only, yes, Dr. Khetarpal has rightly said that there are certain private insurance companies, then GIPSA, absolute cartelization of insurance business by public sector insurance providers. So all these things in Delhi, bit difficult, because my experience is here, bit difficult because this is an urban center with high income group population, and a large number of population is otherwise also covered under kind of schemes like CGHS. So CGHS penetration in Delhi must be much more than any other city. Then there are other Delhi government schemes, and then municipal corporation and universities and banks and railways and defense and whatnot. So the population is totally varied. Then what happens is that there are big hospitals available, big hospitals to look around, then many people start just comparing their entitlements to the better facilities available or more good looking facilities available. That is why there is a whole sort of mixing up in this particular area. And at the same time, the heaviest or the fiercest regulatory mechanisms working here, lot of issues with doctor-patient relationship getting eroded day by day because of so many reasons beyond the scope of discussion here. The kind of scheme with PM-APJ, this Ayushman Bharat scheme, with so low rates, only operational costs can hardly be met with the kind of standards these corporate hospitals are providing, and there cannot be two separate benchmarks for different set of the people. It becomes really a big challenge, and that is why most of such hospitals have hardly adopted it. They were already baffled by the absolutely dismal CGHS rates, which sets a benchmark in all other insurance companies. CGHS rates were last revised almost 8 or 9 years back, and that too after so much of efforts. So
sustainability is always
sustainability to the private healthcare system here, where it is not being funded by any philanthropist activity, or the players themselves are a commercial organization to set up the things. It is really very much doubtful here, and it requires to be funded heavily on the part of government, and probably the grading should be city-wise or. And second, and the most important thing I'll say, the regulatory mechanism, the Consumer Protection Act, as it has come again now in 2019 also, leads us nowhere. Because the safety mechanism, all these quality issues and other issues are so heavily taxing that if we provide the equal quality costs, safety costs, and these quality, safety and luxury are the three keywords where they have totally unlimited proportions. And that is why doctors are turning into totally defensive medicine. The defensive mode requires a lot many things to be done, and with the amount of money provided by these schemes, right, these things are totally untenable. That is why here it is rather difficult to comment.
Thank you. And I think you want to say something, add something? Dr. Narin, what do you think that which will determine the success or failure of this scheme? What are the
Right. I think first of all, to understand whether this scheme will succeed or not, we need to understand how the scenario of healthcare has changed since independence. See, initially our country started with some charitable hospitals, which was obviously insufficient, followed by Government of India taking an initiative and starting primary healthcare centers, secondary and tertiary care centers. But soon they realized it needs very high investment and they were not sustainable. This is when some small clinics and then nursing homes started coming in, and the majority of the needs of healthcare were together met by these. But as the time went on, some corporates also entered into the scene, and quality of care which was available for those patients who could afford improved phenomenally. At this stage, insurance was also introduced, and it gave a relief to certain amount of patients, individuals, as well as some corporates also started taking this insurances, and it helped people who could not afford to, go and get care from different hospitals. But this left the poor of the country in the lurch. The majority of the population who could not afford the treatment had no choice, and they could not afford the insurance, plus government hospitals were not good enough or could not cater to them for various reasons, and they were being left out. And this is the stage when the need of a very large insurance scheme was felt and Ayushman Bharat was introduced. That's what I felt. I think it is a step in the very right direction. And basically, if we try to analyze the tier 2 and tier 3 and rural areas, you see, they did not have much of healthcare. With the introduction of insurance and availability of Ayushman, more and more people were encouraged to set up small setups and start giving healthcare and sustain themselves. But they had to realize, and the government also has to realize, that these setups need a large investment, a regular flow of patients and revenue is required so that they can get their revenue or cost back in 5 to 10 years. This is a model which has to be designed and has to be kept in mind. If it doesn't happen, it will not succeed. And if you go to the tier 1 cities where the setups were already existing and they were able to provide good care and to the people who could afford, who had insurances, the Ayushman can also be taken up for in those for those patients where the unutilized bed capacity in these hospitals can be utilized if there is a definite, even if not profit, but maybe at the same cost at what they are incurring. That way, this model can work very well. But you see, uh, as implementation, we see that there are a lot of gaps. The rates which have been provided, maybe they are working in volumes for smaller cities, but no corporate is willing to take Ayushman because it is not sustainable. So this is something which government has to think about if they want that this scheme should succeed. I think doctors have given so much of their life. They are at rough end at the moment because government every day is asking for different conditions, cappings, and compliances on one hand. Patient is also getting very rigid and has started a lot of questions which are unreasonable at times. And in such circumstances, I think a doctor expects at least some amount of profit if he wants to do business.
I think very well said, Dr. Narin. We have little overshot the time. Yeah, I think only one question would be allowed because we have little overshot the time.
One
Dr.
comment I would
Rajesh
like
Shah,
to put.
yes, please.
He has rightly mentioned there is a great problem in implementation of the things. I was fortunate to have interaction with the help of Abzalji and Manishji in 2019 with the CEO of Indubushan. And implementation at the private clinics level is a very, very difficult task. One surgeon family and anesthetist wife both have started to help the poor people, and around 2 crore of rupees were unnecessarily built up in the problem, and they have leave the practice and they have started running to get the money back. So that is also one of the scenario. And another important thing I would like to draw, today's Gujarat manifesto, election manifesto, has increased state level raising from PM-JAY 5 lakhs to 10 lakhs rupees. So this is another important information to the house.
Breaking news.
Yeah, breaking news.
Great. Yeah.
And one question to Shuchin ji, that is it necessary to speak on PM-JAY with the PM beard on the face?
I think wonderful. It was a wonderful session. I would have loved to ask more questions to my panelists, but time is not permitting. I'm sorry. I had many more questions, but even the audience would be having some more questions. So off the stage, you can always ask. And to sum up, I think Ayushman Bharat is a wonderful scheme, the largest health insurance scheme in the world. I will not tell the numbers, how many beneficiaries, there are nearly 30,000 hospitals which are empaneled with Ayushman Bharat as on date, and of which I think public hospitals, they contribute majorly, I mean, more than the private hospitals. There are about 12,000, 13,000 private, and rest are public. Because even if you say private, there are two categories of private hospitals, which are, one is for profit, another one is not for profit, and the public. So there are three categories of the hospitals across the country which are empaneled with Ayushman Bharat. And numbers are of course increasing. The spend is also in crores. Beneficiaries, they increase from 10 lakhs to now 13.5 or 6 lakhs. So, and even during COVID time, Ayushman Bharat came before COVID. So even during COVID time, Ayushman Bharat did a wonderful job. And number of tests and number of treatment and the medicine. I mean, they have done a wonderful job. All the hospitals who were Ayushman Bharat and Panel. You all know that, COVID, how we all managed COVID, and it was a very unprecedented situation which we all faced, but it was managed very well. That is kudos to our country, I must say, the Prime Minister. And Ayushman Bharat, of course, it has got a good side and of course a flip side of it also. But then overall, if you see, it is a very good scheme. And if implemented in letter and spirit, there are some good models. We have some stalwarts sitting here, Commander Bali and Doctors Sajal. They are doing a wonderful, and they are all praise for Ayushman Bharat. I think such models the country should follow. Actually, we should, I think, make a note of it. And if adopted in such a way, with incentivization, with the viability fund gap and 5 years of that. That is by state or the center? Viability for gap funding. By the Shrine Board. Okay. See.
For the record, no money is taken out from the hospital. Entire money is put back to the hospital. So NS does not take it.
Oh, sorry. That is also same model. Yeah. So I think these are the really wonderful examples, which I think we must. इसके गाने चाहिए actually. Something which we need to पूरा शोर मचाना चाहिए. Very good, honestly, and thank you very much. As we had a wonderful good team of panelists and a wonderful discussion, and I could see the audience very active, alert, and thank you, audience. Thank you very much.